Oh, nice.
All right, hello everyone. Welcome to our third workshop for today. Today we're joined with physical therapist, Mr. Derek. Mr. Derek, how are you doing today?
Hello, good. I'm doing well. How are you guys?
I think we're all doing good too. It's been a pretty eventful day so far, and we know that this workshop is going to add on to that chain. So we look forward to what you got to hear or what you got to say. Sorry.
Perfect.
So we know a lot about therapists. In fact, we had another occupational therapist pull up a little bit earlier today, but you're a physical therapist. So could you kind of explain what the role of a physical therapist is in the hospital?
Yeah, absolutely. So specifically, I work in skilled nursing homes. So it's a little bit different. Each setting for a physical therapist is different. I would say my particular setting, we're focusing more on getting in and out of bed, transfers, and walking. So it's rudimentary skills, but it takes skill to do those things with the patient population that we're dealing with. So that's kind of my background. And getting up out of bed, for example, could be somebody who's been in bed for months. Could have been somebody who had recently been in a car accident and they're just trying to get up for the first time. So when I say get up out of bed, it's a wide range of people getting up out of bed. Transferring, same thing. You know, we always get up out of bed when we first wake up, sit into a chair, let's say. Sometimes for these people, they need to be what's called a Hoyer sling. So we'll have to put them in a sling, put them in a chair. And when I say walking, walking can be a number of things, whether it's just get up, walk, maybe they need a cane, maybe they need some type of sling to help them. So that's basically my background.
Yeah, that seems super interesting. And you mentioned that you probably work with a whole bunch of different people on a daily basis, and
Mm,
I'm sure almost every case differs for the
yeah.
most part, at least. So, how do you treat patients with progressive or degenerative diseases in
Yeah.
comparison to ones that are like more on this, I don't want to say simpler end, but like on the more one-time end, such as like a broken ankle or broken foot?
Right, right. Yeah, so that's actually a really good question. So when you go to PT school and when you go to undergrad and even high school and below, they talk a lot about your nervous system. So your brain, for example, um, the people that are what are considered progressive or who kind of fluctuate with their assistant levels, those are primarily neurologic. So somebody who has Parkinson's disease, one day they may be really good. A couple of days later, they may not. They may be what's called freezing, where their movement patterns are slower. So you need to just be aware of that. So just because it takes a lot of assistance, let's say going to the bed example one day, and then it's very easy the next day, you need to know that there could be an influence of some neurologic issue. So it's not as rudimentary as it may look, where they're just like, oh, they're not doing well, they're having a bad day, let's discharge them. No, it's a little bit more involved than that. But for example, like let's say somebody who breaks their ankle, there's typically a progression. The orthopedic doctor will provide details as far as when they should be progressing and how and what. And most of that is based on physics, ground reaction forces, pressure, lots of just basic things that can't really change. So you should be able to go from A to B within, let's say, 3 months. So it's just having that awareness and being attuned to that.
So since you talked about how you work in nursing homes mainly, so
Mhm.
COVID must have had a tremendous impact in especially in that workspace. So how
Yeah.
did your team deal with that?
I think it's just honestly being aware of what COVID was and what COVID is. I think it's really important to understand the pathogenesis of it. You know, if you ask, what is COVID? Is COVID something, if I touch something, it's going to get me right away? I mean, no. I mean, what COVID is, it's in the air, so to speak. So you need to just account for that. So, like for us, most important thing would be masks, in particular with us, N95s, face shields. So being really educated on what is COVID as a virus, for example, and how does it infect others. And once you understand that, doesn't mean you run away and hide. You put on the defense mechanism to combat COVID, and then you work with patients in that environment.
Yeah, I definitely agree. I think learning about COVID helped not only medical professionals, but like the entire general public. And
Yes.
talking about like the COVID times, how have
Mm.
your work hours been? Like, have you had to like work overtime? Have you ever had to work in overnight shift? How's
Yeah.
that been?
It really fluctuated. I worked in two buildings for a long time. up until last year. And then I switched over to a larger building and just focused on staying in that building just because the risk was too much going from building to building. So I would actually say the hours were less because you really had to be attuned to what you're dealing with. Doing more is not always the best. I think in the particular situation of COVID, you wanted to stay in one place and isolate with those people to make sure that you mitigate the risk of spread if you were to get COVID.
Yeah, of course. And while we're on the topic of COVID and therapy as a whole, involves a lot of communication, but obviously with COVID, you can't stay as close to each other. You can't develop that physical contact. And obviously that makes it a lot harder to build strong relationships.
Yes,
So
yes.
how did the way you make relationships during COVID kind of change?
I think it goes back to the education, asking yourself, what is COVID? I mean, sure, there's social distancing, that's very important, and masks, that's very important. But taking it one step further, it doesn't necessarily mean I need to be isolated myself. I just need to know from the science what's going to allow me to continue my job, to educate. Because if you're not educated, what happens is you become fearful and panic, and then no one knows what's going on. So the more educated you are to be in that environment, then the better things are, because then there's trust. People are around you in a much different environment, and you move forward. If you're not educated, then you're not going to be involved, and then you're no help at all. So get educated, understand what it is, and then just work in the environment as a team.
Yeah, and while we're on the topic between therapist patient like relationships, sorry about that. Have there been any like difficult patients you've had to deal with, and how did you go about dealing those?
It's a tough call for what's difficult. There's physiological difficulty where they have a lot of what's called comorbidities, a lot of medical history. That can be difficult. Some people come from different backgrounds where, let's say, it's more psychologic or psychiatric. So then you're not dealing with the physical, but you're dealing with more of a mental ailment where you just need to be aware of. And then on top of that, you have to think of the influence of, like, for example, psychiatric issues. You can't just give a patient multiple psychotropics or medications. So understanding what the balance is where a patient is at that particular time with their diagnosis. I think it's just really just understanding what is the picture. It's not always a physical picture. It's not always a mental picture. Also, I didn't even mention what's the socioeconomic issue. What's going on in their personal life? Do they have children? Are they homeless? Do they have a home but someone recently passed? That can be difficult. So how you define difficulty, it's important to keep an open mind of how you define it.
So we've been talking a lot about like COVID in the current situation, but we want to backtrack real quick to like probably a while ago. So can you talk about the path you took to reach where you are, like let's say starting from high school all the way up to now?
Yeah. So I was, I think, 17 years old. I became one of the youngest personal trainers in the United States through a certification. So I worked as a trainer for a while in high school and college. Then I started to volunteer in an outpatient clinic. And then you really got to see, I'm all for getting people in shape, and it's really important to do that, but taking it to that next level, that more almost like a spiritual level of helping people that need the most help. So I think as you grow as an individual, you start looking at life differently. So for me, that was my progression was, fitness, let's get strong and healthy, but then there's another aspect, and for me that's where I started to ask questions about what are the other questions, how else can you help people, and that's how I ended up in therapy. And then from there it led to nursing home, which is, those people need a lot of help.
So during this process, how do you describe like your schooling experience as like a physical therapist? Like, do you think it was hard? Were there any problems?
Yeah, no, physical therapy is definitely a hard program to go through. I don't think it's easy at all. I definitely think it challenges you. But with that challenge, it will definitely make you a better therapist, but more importantly, a better person. And for pretty much for all healthcare professionals, because when I went to PT school, when we were in anatomy class, it was us We had the dental students working on the mouth. We had the medical students in the other room working on other things. So, everyone was in it with the same idea of helping. And then that just was their path.
Yeah, and while we're on the topic of all sorts of professions, when you're working in your environment, do you see yourself working with all types of different professions, whether it's like other therapists or just other people in the medical field in general?
I don't think as much. So I helped in a rotation with a hospital one time. It was with an acute intensive care unit. There's about 7 intensive care units. It was a teaching hospital. We worked with tons of people. So for my profession in skilled nursing, it's primarily occupational therapy, nursing, speech. You'll see the doctor. But if you're really trying to get saturated with a lot of different people and a lot of different backgrounds, I would actually advocate for people to go into the hospital setting and taking it one step further, working in a teaching hospital, at least initially, because you're going to be involved with so many people. We're involved as well, but I would say that's the place that you want to go initially to really get your feet wet and understand different backgrounds.
Yeah, and while we're on the topic of different backgrounds, I'm sure all sorts of backgrounds have all sorts of different experiences. So is there any special cases or instances within your experience that you felt like was very special or very interesting? Like any patients or anything that you found interesting?
I think for me, the longer I'm in it, the more you'll see a universal concept, and that's of people wanting to get better. The people that intrinsically want to get better, I think that's what helps me and motivates me, because here, these individuals, they're just trying to do the most basic things. And the individuals that put their heart and soul into doing the most basic things, that's what I find to be, the thing that I look to, because that really motivates me to say, well, if they can do this, then I can certainly drive to work. I can certainly get up and walk and do all these things. They're just trying to do the most basic, and they have the motivation and the will. So when you see those individuals, it definitely moves you and changes you. So it's more of a trait, personality trait that you'll start to gravitate to, which is pretty interesting.
So you talked earlier about like your experiences with patients. So has there ever been like a really rewarding experience with a patient where you felt like a lot of satisfaction? Like maybe you started at like a really low level and you slowly took things, and after that, like there was a really big impact on the patient.
Yeah. So I worked at a clinic a couple of years ago, and this individual was in a car accident. And the doctor initially gave him non-weight bearing on both legs, meaning you can't put any weight on your legs for, let's say, I think it was maybe 2 months. And then it went to toe touch weight bearing, which basically means walking on eggshells with both legs. So how do you progress somebody? So I ended up using what's called the light gate, which is a harness walking device. Sometimes you'll hear it's called the 0G. But we basically follow the protocol of toe touch weight bearing on this harness device on a treadmill, making sure there was a certain amount of pressure for X amount of months, working on all the concepts of Wolff's Law, stuff you'll learn about, bones, how you develop them and the bone density. So, seeing them, and then we made it all the way up to full weight bearing. But if we didn't start with this device, putting them in this harness machine, checking the pressure, seeing how much pressure they had on their legs, and initially, the outcomes and the prognosis wouldn't have been as good. So to see that using your what's called evidence-based practice at the right time and actually seeing it work was pretty motivating.
Yeah, I definitely agree. Lots of times, like in a job, when you have like experience like this where you make a drastic impact on someone's life, it can be like really satisfying.
Yes.
Yeah, and when you were in high school, you said you were a former physical trainer and
Yeah.
that the experience helped you reach where you were today. So
Mhm.
just like that, do you recommend any opportunities for high schoolers who are either watching this live or who are going to watch it on YouTube so that they can like start thinking about what they're going to do in the future, or maybe as a physical trainer or
Yeah,
physical therapist?
absolutely. I tell them, I would say volunteer and try to do as many things as possible. I mean, it's good to have your joy of what you do, whether it's working in a gym, but I would say don't be so focused on one thing. Keep an open mind. Because you're younger, you're more easily influenced. And if you gravitate to one or two things younger, you may choose to do those one or two or three things into college, and then that could manifest completely differently. But I would say don't hone in on one thing. Open mind, volunteer all the places you can, If you can find a mentor, great. And just keep an open mind and be a sponge.
Yeah, for sure. I'm going to backtrack a little bit to when you were
Yeah,
talking about your special cases and how you
yeah.
used equipment such as a treadmill and like a harness and all of that. So
Yeah.
those are all like different pieces of technology, but are there any really other like mainstream equipment physical therapists would use, like any common equipment?
I think for me, they have lots of equipment, but I think it's good to go back to the basics. So like for physical therapists, what are we working on? Muscle, bone, balance. So I think things like weights, um, things like this harness machine, using evidence-based practice. So for example, you'll have a lot of pulmonary patients, and they need to get up. So there's really no rocket science. You got to get them up. So I think it's sometimes look past all the equipment and these things and those things and just go back to basic physiology. Look at the evidence to support basic physiology and then just go with it. I think sometimes we get so wrapped up into different types of devices and new technologies. And if you look at the human, I mean, we've been around for thousands and thousands of years. So, none of that was there, not even 100 years ago. So I think it's all about going back to the basics and really just asking yourself, what does this person need and how can I therapeutically do it correctly?
Yeah, and while we're on the topic of technology, obviously been a huge growth in robotics, AI, and all sorts of other sorts of technology. How do you feel that your field of physical therapy will be impacted by all this robotic growth?
I do think robotics is beneficial. And I do think that sort of technology has its areas where it can help people, especially with people who have stroke or cerebral vascular accident. They do very well with what's called motor planning or motor learning. So if you can increase the frequency to which they're doing a motion, then you're tapping into what's called neuroplasticity. And that's where you're actually changing the brain's network to do certain movements that are different now than how you used to move. So I would say technology for motor planning, motor development, working with stroke, CBAs, then yes, absolutely. The other ones, I'm sure they have a lot of help. But for example, for bone and muscle strength, I think the concepts are pretty basic. But for CVA, stroke, neurologic, it's a little more involved. And so maybe you could tap into that motor planning and repetition and movement.
Yeah, I definitely agree. Technology has really changed the way most medical professionals work. And I'm going to
Mhm.
go back to the nursing topic.
Yep.
So, since you worked in a nursing home and lots of the patients were probably really old and might have a hard time understanding some things,
Mhm.
and just average patients in general have a hard time understanding complex medical terms, how do you communicate like complicated medical information to your patients in order to build like the trust and foundation you need to help cure them?
And when I say language, I mean more so of the language of your body, your mannerisms, understanding how individuals respond. So it's more of the language of where are they comfortable. So for me to go into a room and say, gosh, we really need to work on your heart. You had a massive heart attack. That's probably going to stress somebody out. So I think it's really just focusing on, like, for the average person, hey, let's get you up and get you stronger, but let's see what you can do day one. Maybe it's just standing. So finding out the language of the person by their mannerisms, their behavior, their body language, and the more people you work with, you're going to pick up with it better. And family, there's tons of family support there. So bring in the family, have them come in, whatever it may be. And during COVID, it was the Zoom call where the social worker would help us out. They'd set up the Zoom call and we'd be with the family that way. So yeah, I think that's important.
Yeah, I definitely agree. I think it's really important to have that trust between your patient. And also, I'm going to go back a little bit to the topic about the future. How
Mhm.
do you see your profession growing maybe like 5, 10 years from now? Do you think that like maybe AI would be able to like replicate the role of physical therapist? Or do you think that your job is going to have a lot of importance in the future?
It's tough to say. I mean, at least from a skilled nursing, I couldn't imagine. I mean, okay, so let's say you had a robot that could get somebody up out of bed and move them to a chair and walk them. or if you have this new technology. But you also have to think of as a corporation, they'll also look at the fiscal impact. So if we're just going to talk strictly business, if it took one robot, let's say that cost 500,000 to do all the things for, let's say, 10 patients a day, I don't know if that corporation would want to hire 10 robots, or something like that. I think that there is room for technology. I just don't know if fiscally we're there yet. I think that they're going to have to continue to focus on what makes the most sense, where that medium is between technology and the human touch, especially with healthcare. And we also mentioned the fiscal aspect. I mean, how much does this cost? And I mean, how could you implement it into a major hospital or a small rural town? I mean, so you just got to think about how will it work? But it's a good idea and it's a good focus, and we need to move forward.
Yeah, for sure. And just building on top of that, I'm pretty sure like people would rather talk to other people rather than interacting with robots. So that's
Yes.
probably
Yeah.
like another thing that physical therapists have on top of technology.
Yes. Yeah. I mean, you need the time. I mean, if nothing else, COVID taught us that even if you're by yourself, I mean, I had a patient one time, they said shelter in place in California. And they said, no, it's suffering in place, because it's just like, you need interaction. You can't just sit in a room. So if you're going to sit in a room, fine, wear all your PPE, but be interacting with me.
Yeah, exactly. And while we're on the topic of PPE, PPE, I'm glad that you brought that
No,
up.
it's hard to say.
um, did the amount of PPE you had to put in also differ, like when you were working with other people in COVID?
Yeah, I mean, I think initially when COVID first hit, no one had any PPE. So, I mean, we were using the same masks for God knows how many days, just because that's all that was there. But now I think we're more prepared, and we have the PPE necessary to work with whatever comes our way. But yeah, initially no, it was horrible, but now it's much better.
Yeah, and I just have one last question, and then I'll hand it over to Maher. I think we're gonna move on to some pre-submitted after that.
Okay.
It's about PT school. So how did PT school differ from other like more commonly known schools such as med school and dentist school? Could you kind of expand upon your experience in PT
Yeah.
school?
Yeah, so well, at least with PT school, it's a 3.5-year doctorate. At least the school I went to is Virginia Commonwealth University in Richmond, Virginia. We had anatomy the first summer, but then it was like everyone went and did anatomy. So we had the dental students, we had the med students. But I would say that each profession is definitely different. I mean, take a medical doctor. Once they finish their 4 years, they're not done. I mean, you're going off to residency, and then depending on that, if you're going to be a surgeon or something very specialized, you're talking, I mean, who knows how many more years? A lot more years. So you just got to be aware of what type of path you're going to take. So I'd say medical doctors, hats off to them. They do a lot just during school. Dental students, I know they do a lot. I don't know if it's the same with medical school where they do long residencies. And then, PT, I said we do about 3.5 years. That's a doctorate, and then you come out licensed, and then you can work in the profession you choose.
Yeah, that definitely makes sense. And I understand some schools, some like professions require lots of work, whereas some don't. But it seems like physical therapists need to get known with like many different procedures, all
Yes.
types of situations.
Yep. Very true.
Okay, so we're going to move on to some pre-submitted questions now.
Okay.
So one of the anonymous users wanted to ask that as a PT, is it hard to manage your work and life balance, especially during COVID?
No, I think the benefits of being a PT is that if you're not a manager, you're considered basically hourly. So you work 9 to 5, which is nice. And you work with the patients when you're there, and when you're not there, you're home. So, initially anyone's going to be stressed out when you're first licensed. You're like, oh my gosh, I'm going to get this person up, and what if something happens? But you get confident in what you can do. And as life happens, which it will for everyone, you'll manage it and you'll balance it. And over the years, with all the, I mean, people that go into these professions are not lazy. They started in high school thinking, I want to get to this place, whatever it may be, med school, PT school, dental school. So, these people, anyone that's involved in this is extremely driven. So those individuals will make it work because they want to work. They are highly motivated people.
Yeah, and as a PT, what do you think is the most like important quality needed to be successful in your profession?
Yeah, I think it's just having an open mind and being balanced, and uh, just not getting too serious about things. I think the more calm you are, the better you'll be able to think, the more clearly you'll be able to think, and realize that when you when you look at a day is so quick. You know, you wake up, you go to bed, you repeat. So if you can stay in the middle and centered and not have these fluctuations in emotions, I think that can definitely be a good attribute.
Yeah, and moving on to some more pre-submitted PT questions. I think these are a little bit more on the personal end. So
Yeah.
do you ever give free consultations to patients or your friends or family members?
No, I'm definitely pretty litigious about that, legally based. So you want to think about the legality of it. I mean, of course, you want to help everyone and their mother, but you also have to realize that the last thing you want to do is misdiagnose or do something that if it was just looked at by another professional, be it a doctor, perhaps, you want to go through that route. Now, some states have what's called direct access. I think Virginia has direct access where they can come to you without referral from physician and you can diagnose, but still that's documented. When you're talking about non-documented care, in terms of medical care, I think it should just be geared to the medical professional.
Yeah, of course. Like, I don't really think that'd be too, I guess, too much of a great idea if you're doing undocumented care because it could really go south whenever
Right,
you're.
right. Yeah.
Yeah. And also another pre-submitted question, how often do you take vital signs and how do you decide when to take them?
Yeah, I think so initially when you're a new grad and you're just starting out, you probably take vitals way too often. But then as you work in the profession, you start to understand the body a little more. So, you know, for example, orthostatic hypotension, you know, what is that? That's basically somebody passing out. So, you know, the longer you work in this setting, the more you'll realize, okay, how does it happen? You know, typically it's with people laying down for X amount of days. So these are the things you're thinking. Are they on any medications like beta blockers or other things? So you do a laundry list check in your mind first as you're working with the patient. And then from there you assess. But if a doctor specifically says, you know, monitor these vitals, you'll do it. But I think over time you'll start to really understand when somebody actually is having orthostatic hypotension or not, or that sort of thing.
Yeah, experience probably helps a lot when it comes to these sorts of day-to-day procedures.
Yes, yeah.
All right, since we're almost out of time, I think we're going to start wrapping it up.
Okay.
Doctor, do you have any final words you want to say to the audience before we end the workshop?
I would just say, you know, continue to focus on your goals. If it's PT, great, focus on it. If it's medical school, if it's dental school, if it's anything really, just whatever you do, stay focused, stay open-minded, stay positive, and reach your goal.
All right, I think those were some great words of advice, and everyone here definitely learned something new today. So thank you so much for taking time out of your busy day to come help us. I really
Absolutely.
appreciate it.
Absolutely. Best of luck with everyone.
All right, thank you.